Hello students, I hope you're doing well and you're fine. Today we are going to look at electrolytes and their imbalances plus water. And as you know very well that we are dealing with how to care of a patient with electrolyte imbalances. So today we are going to have an introductory lecture what we mean by electrolytes. What do we mean by electrolytes? What do we mean by water? What do we mean by things such as imbalances? Now, by the end of this lecture, you should be able to know all these things, yeah? So please bear with me. We go through this lecture, and before you know it, you will be able to understand what we mean by electrolytes, what we mean by water, what we mean by what we refer to as imbalances, right? So you have to know the composition of the body, what your body comprises of, yeah? What your body comprises of. Now, your body comprises of things like, macro elements and what we refer to as micro elements, yeah? So we have what we refer to as macro and micro elements, yeah? Now, by macro elements, we basically mean things like proteins, lipids, carbohydrates, fats, among others. But also you have micro elements, and by micro elements, we basically refer to as things like ions, yeah? Or what we refer to as electrolytes. But you also have other things like waste products, things like, radicals and all those things. Now, those ones fall within the miscellaneous. Now, it is also very important for you to know that your body has a very high composition of water. And as you can see, water is about 60%, yeah, of your whole body. So in other words, you cannot do away without water. That is why actually they say that water is life. So it is very important that you should know that your body contains about 35.8 liters. Can you imagine? Can you imagine that your body is about 35.8 liters? Rather the components of your intracellular, in other words, the water that is located within your cells is 38.5 liters. Now, it is also very important for you to know that the body is composed of what we call compartments, yeah? Compartments. Now, the compartments can be, there's what we call intracellular, and what we refer to as extracellular, yeah? So that basically, those are the components of your, and you realize, as you can see from the graph, that the intracellular component, has a lot of water compared to the extracellular component. Now, as we have already mentioned, your body, total body water, yeah, is basically 65%, yeah, and most of it, or 2/3 of it, is basically found within the cell, yeah, or that is what we refer to as intracellular. And then a third is found extracellular, and that third which is found extracellular is also further divided into several compartments. Like, for example, interstitial fluid. Interstitial fluid, that is the region outside your cells, yeah, that is what we call the interstitial space, or that is where you will find interstitial fluid. Then we have 5 to 8% of the water, of the fluid, within the vessels, what we refer to as intravascular. And then we have 1 to 2%, out of what we refer to as potential spaces, like cerebrospinal fluid, intraocular, serous membrane. So that this is referred to as transcellular fluids. Yeah. So, but the point to take home here is that the intracellular takes a lot. In other words, it consumes more water compared to the extracellular. And when we talk about intracellular, we mean within the cell. Now, if you can see that diagram, it is basically self-explanatory. So again, that is it. That is it. We shall not talk about it more. And we are saying that the major components are basically extracellular and intracellular, which we have talked about already. Now, it is also very important for you to know the ions, yeah, that are found within the cell, yeah. So the ions are very, very important, yeah, in the different processes that take place within our body, yeah. Now, we have ions that are found intracellular, yeah, intracellular, and we have ions like potassium, yeah. We have ions like magnesium, and we have things like phosphate, yeah. Now, those are found within the cell, yeah, or they are referred to as intracellular, yeah. Now, we have extracellular ions, yeah, extracellular. We have ions like sodium, yeah. We have ions like chloride, and we have ions like bicarbonates, yeah. Bicarbonates, yeah. Those are found, without outside the, the cell, yeah. So it is very important for you to know, because if you're able to tell, if they tell you whichever ion you're supposed to know that it is this particular ion that that is basically responsible, or that it is supposed to be found here. And if it is found in the reverse, if it is found in the reverse, then it is said to be an abnormality, yeah, or it's said to be an imbalance. Or if it is found in excess, yeah, then it is said to be an imbalance. So within you, you should know that ions that are found within the cell are potassium, magnesium, phosphate. And ions that are found outside the cell are sodium, chloride, and bicarbonates. Actually, bicarbonates is written like that, yeah? Bicarbonate ions. So we want to look at how electrolytes and how fluid basically enters in and outside of the cell. Now, there are 4 processes, yeah? There are 4 processes by which ions or even electrolytes enter cells. And one of the processes is called diffusion. There's what we call osmosis, active transport, and filtration. Now, we're going to go through these one by one, and you should be able to know how each plays part in in having these cells of fluid within the body. Now, diffusion. You have heard about this term diffusion when you're in primary, secondary, maybe in A level. Now you meet it again. You meet it again. Diffusion, and it is basically a passive. It is a passive kind of transport. Yeah, and it basically involves substances moving from where they are high in concentration. Yeah, to an area where it is lower in concentration, and until you have kind of like even distribution. This is what we are trying to say, that if you have something like this, yeah, and then you have maybe something like that, and then here you have maybe ions, yeah, something like that. Now, if we have few of these this side, yeah, then you'll find these ones moving that side, yeah, by basically passively, yeah. In other words, it does not involve energy or any form of energy. Basically moves from high, very high concentration to a very low. In other words, where those substances are low, yeah. So processes that happen here, like for example, during gaseous exchange, yeah. During gaseous exchange, you find that within our lungs, yeah, when we breathe in, within the alveoli, there is too much oxygen, yeah. And on the other hand, within the bloodstream at the capillary level, there is really too little oxygen. Yeah. So what actually happens is that the oxygen diffuses out of the alveoli. It diffuses out of the alveoli into the blood. Yeah. And then the carbon dioxide does the opposite. Right. Now that process is what we refer to as diffusion. Now, osmosis. This is basically movement of water, yeah? Remember we said with diffusion, it is any particle, gas, yeah? Mostly gas, yeah? But with osmosis, we are talking about water, yeah? Across what we call a semi-permeable membrane, yeah? So water is crossing, just imagine again that this is water, yeah? This is water, and this is our semi-permeable membrane. Now, water basically diffuses across. Yeah, rather, no. It moves. Yeah, it moves across. Yeah. So we find water moving across. Yeah. So that is what we refer to as, osmosis. Now, it moves up to a point whereby, there is equalization in concentration. Yeah. So in other words, it basically moves this side because there is a high concentration gradient over this side, yeah? In other words, if it is salt, there is too much salt or sugar, yeah? In other words, there's too much concentration here, so the water moves, yeah? Now, that water will move until there is an equalization, or until there is equilibrium in concentration, of the ions, yeah, on each side of the membrane. Now, that is what we refer to as osmosis, and this is very common. Like for example, in plants, yeah, water movement in plants is a very good example of this, and also it is also common, especially with the movement of solids, rather movement of water across a cell membrane, yeah, across a cell membrane, yeah, because the cell membrane is said to be semi-permeable, yeah, and extracellularly we have water. So what actually happens is that the water moves inside the cell by a process called osmosis. Now, there's another one which we refer to as active transport. Now, with active transport, just like the word itself, active, it basically means there is some use of energy. Just like the word active, yeah, it basically means there is some use of energy. So here we have molecules of ions moving uphill against what we refer to as an anosmotic or concentration gradient. Yeah. So ideally, ions, yeah, are supposed to move with the concentration gradient. In other words, they are supposed to move where it is low. Yeah. However, with active transport, they can move the other way around. Yeah. They can move from where they are probably less concentrated to where they are high concentrated. Yeah. So, and that is basically by use of energy, yeah, and the energy that is basically used is what we call ATP, yeah, or what we refer to as adenosine triphosphate. Now, this is this energy is provided, you know, from the macro elements, things like carbohydrates, lipids, you know. This is where we generate our energy by processes like, for example, glycolysis, yeah, these ones provide us with energy. So it basically requires a special carrier or molecule, a carrier molecule or a special enzyme called adipase, yeah, adipase. In other words, this kind of, because this requires energy, so there should be conversion, you know, of, you know, there should be conversion to energy, yeah. That is why we need things like, you know, this enzyme ATPase, yeah? And so things like sodium, potassium, calcium, plus some sugars, amino acids can, you know, can use or can make use of this active transport. Now, a very good example is what we find on the cell membrane, and in case of what we refer to as a sodium-potassium pump, yeah? Now, the sodium-potassium pump, yeah? Now, this sodium-potassium pump is located, you know, it is always located on, you know, on the cell membranes, yeah? And as a result, what actually happens, it uses energy, that the ATP, yeah, it uses that energy to make sure that it pumps the sodium outside of the cell. Yeah, so it pumps the sodium outside of the cell, yeah? And it then pumps potassium inside the cell. Yeah, so that pump basically utilizes energy to be able to maintain the sodium outside of the cell while the potassium within the cell. Now, naturally, that is how it is supposed to happen. Now, if there is a problem with the pump, then the reverse will happen, and then we shall have things like cellular swelling, yeah, which is basically an abnormal thing. Now, we also have things like amino acids and some sugars, yeah. We might need them probably in a cell, yeah, and there is need for active transport of these products within the cell, yeah. So we basically need the active, you know, we need the active transport within the cell. Now, the other one is basically filtration, which I'm sure you know, movement of fluid through what we call a selectively permeable membrane from an area of higher hydrostatic pressure to an area of low, you know, hydrostatic pressure. Now, this is very common. This is very common, especially at the you know, at the ends of the capillaries. Yeah, this is what we mean. This process is very common at the end of the capillaries. Yeah, just imagine this is your capillary. Yeah, this is your arterial. This is your capillary end, and then this is the venule. Yeah, this is your arterial, we said. This is your capillary end, and then this is the venule. Now, there are several forces that act. Yeah, several forces that act along here. There's what we call the hydrostatic pressure, and there's what we call the oncotic pressure, or the plasma oncotic pressure. So plasma oncotic pressure, OP, yeah. Now these two forces, yeah, when they reach at the capillary level, usually the hydrostatic pressure is higher than the oncotic pressure. So as a result, the fluid moves out, yeah, moves out of the capillaries to the what? To the parenchymal cells, yeah, or to the interstitial space, yeah. So that basically means that this process here is basically, you know, filtration, yeah, filtration, whereby we have higher forces through this higher forces, a higher force forcing fluid to move out of the capillary into the interstitial space. Yeah. Now that is a process called filtration. It is also very important for you to know the role of hormones, yeah, as far as electrolyte balance and water are concerned. Now, we have two hormones that you should not miss, yeah. We have two hormones that you should not miss, yeah, and we are going to talk about them one by one. Now, the very first hormone that you should always know, I repeat, the very first hormone that you should always know as far as regulation of water is concerned is what we refer to as the antidiuretic hormone. Yeah. So ADH, ADH, yeah, anti-diuretic hormone. Now, ADH is, of course, what is a hormone? You will ask, what is a hormone? Hormones are basically substances that are basically secreted in blood to go and act at several places to cause changes there. Now, antidiuretic hormone, also called ADH, this one is basically manufactured within the hypothalamus. And basically its role is to conserve water. In other words, it makes sure that water is absorbed, and its point of action is within the nephrons of the kidney. Yeah. Now you should remember that it is basically made from the hypothalamus, and the hypothalamus is located in the head or in the brain. And then it is stored in the posterior pituitary gland, yeah, and it acts at the nephron, yeah, in the nephron at the level of the collecting tubule to cause reabsorption of water. So that basically means that in cases of dehydration or in cases where you really need too much water, that basically means this ADH is in high amount to want to cause or to want to bring water reabsorption within, in our bodies. Now, if the blood volume decreases, then we have ADH released and then water reabsorbed by the kidneys, yeah? And then if the blood volume is too much, then there's what we call a negative feedback. It basically causes the ADH not to be released, yeah? And therefore it reduces in amount and therefore a reduction in water absorption. Yeah, so that is basically the role of ADH or antidiuretic hormone. And you know very well that if it causes absorption of water, then that means that you will not have adequate urine. Yeah, and we are going to look at some of the problems that can come as a result of the imbalances in this ADH. Yeah. The other hormone that you should be aware about is what we refer to as aldosterone. Can you repeat after me? Aldosterone, yeah? So aldosterone is also another hormone, yeah, which is basically produced, by the adrenal cortex. Now, the adrenal cortex or the adrenal gland, if you know very well, the adrenal gland, if this is our kidney, yeah, if this is our kidney, the adrenal glands are usually located at the top of the kidneys, yeah, at the top of the kidney. Now, this is what we refer to as the adrenal gland. Now, it has two parts. It has what we call the adrenal medulla, which is the innermost, and then the adrenal cortex. Now, it is the adrenal cortex that is responsible for production of aldosterone. Now, this aldosterone also acts at the nephron, yeah, within the kidneys to cause reabsorption of water, yeah, to cause reabsorption of water. And specifically, it acts as the distal convoluted tubule. Now, it is also released as part of the renin-angiotensin-aldosterone system. We shall look at that, yeah? We shall look at what we refer to as the RAS, renin-angiotensin-aldosterone system. We shall look at that. But it is also released as a result of that. Now, it is responsible, we said earlier, for absorption of sodium, yeah? And remember, where sodium is absorbed, water follows. You shouldn't forget that. Where sodium comes, water follows, yeah? So that is very, very important. So it causes absorption of sodium, yeah? Absorption of sodium within the distal convoluted tubules, yeah? Now, if it causes absorption of sodium, that basically means that since there is absorption of sodium, the water will also follow directly. Yeah, the water will also follow. So basically, that is that about aldosterone. Now, the other one is renin. Yeah, renin is also a hormone that you should not forget when it comes to water regulation. Yeah, water regulation. Now, renin is a hormone. Yeah, that is basically produced in the juxtaglomerular within the nephron of the kidneys. Yeah. Now, renin, what actually renin does, renin causes conversion, yeah, of angiotensinogen, yeah. It causes conversion of angiotensinogen. So we are saying angiotensinogen it causes conversion of angiotensin to angiotensin 1. To angiotensin 1. Yeah, so the process that does this is what we refer to as renin. Yeah, renin. The enzyme that does this is renin. Now, after causing production, formation of angiotensin 1, yeah, it basically now this angiotensin 1 is converted to angiotensin 2, yeah, by an enzyme which is located within the lungs, yeah. And that enzyme which is located within the lungs that causes conversion of angiotensin 1 to angiotensin 2 is called angiotensin converting enzyme, yeah. So you have angiotensin, you have renin causing angiotensin 1, yeah. Angiotensin 1, this is renin, yeah. So now angiotensin 1 is converted to angiotensin 2 by an enzyme which is located within the lungs, and that enzyme is called angiotensin converting enzyme, yeah. That enzyme is called angiotensin converting enzyme, also referred to as SCE, yeah. Now, once it causes conversion to angiotensin 2, now this angiotensin 2 basically is a potent vasoconstrictor, yeah. It causes vasoconstriction, but not only does it cause vasoconstriction, it also causes release of aldosterone, yeah, from the adrenal glands, yeah, and of course it does other things, but the most important thing that you should not hear are two things: release of release of aldosterone, and then causing or bringing about vasoconstriction. Yeah. Now, when this happens, of course, you know the role of aldosterone. Yeah, and so you will have you know, more iron, more sodium absorbed, and as a result, you will have sodium, you know, reabsorbed, and therefore water will follow. Now, that is those are the three basic or three most important enzymes, yeah, rather hormones that I wanted you to know, yeah. And so the other thing we want to look at are things like what we call solutions, yeah, solutions. And solutions can be categorized into three, yeah. Solutions can be categorized into three. They are what we call isotonic, yeah. They are what we call hypotonic, and then they are what we call hypertonic. So solutions can be categorized into these, yeah. There's what we call isotonic, hypotonic, and then hypertonic. Now, all these solutions are needed within our body, yeah? And we are going to see what they basically mean. But an isotonic solution is basically a solution that has the same concentration as our plasma, yeah? As our plasma, yeah? So the same concentration as our plasma is referred to as an isotonic solution. And the examples have been given there, like sodium chloride. Now, these common bottles that you usually see in hospital being given to, you know, to patients. Like, for example, if a patient is bleeding too much, you know, they are given fluids, and the most common that they usually give is sodium chloride. Now, sodium chloride is said to be isotonic because it has the same concentration, just like our plasma, yeah, just like our plasma. The other solution is Ringer's lactate, yeah, and then lactated Ringer's, yeah. We also have things like 5% dextrose. We have then hypotonic solutions. Hypotonic, this basically means they have a lower concentration. Hypo means low, yeah. Hypo means low, so they have a lower concentration than the plasma, yeah. So things like water, distilled water, things like 0.45% sodium chloride, yeah, and then 0.33, yeah, sodium chloride. These are basically, you know, hypo. You know, they are hypo. In other words, they have a lower concentration compared to our plasma, yeah. Now, the other one is the others are hyper. Just like the word hyper, it basically means their concentration is a bit higher compared to our plasma, yeah? So the reference point is always your plasma. The reference point is always your plasma, right? So things like 3% sodium chloride, things like albumin, parenteral nutrition feeds, you know, 50% dextrose, all these hypertonic solutions. Now, let's talk about electrolytes. Now, an electrolyte is basically an ion, yeah? An electrolyte is an ion, and it's basically when a substance is dissolved in solution, it separates into, you know, ions that are supposed to carry electrical current. This is what we mean. You have a solute like sodium chloride. Just take an example of salt, yeah? Salt is sodium chloride, right? So salt If it's not ionized, it is like that, yeah. But then once you add in water, yeah, it basically ionizes to form sodium ions and chloride ions, yeah. So these are what we refer to as the ions. In other words, when a substance is dissolved in solution, yeah. In other words, when a salt, let's say a salt is dissolved in solution, yeah, it forms ions, and these are the ions, right? So sodium and chloride, right? Now the positively charged are what we refer to as the cations, yeah? While the negatively charged are the ones we refer to as the anions, yeah? Is it clear? And these things in our body, we are going to always find them as the units that are used to measure them are milli equivalents, yeah? So you will always find that, yeah? Milli equivalents per liter, yeah? This is what you will always find, yeah? Like, for example, the normal concentration of sodium is 135 to 145 milliequivalents per liter. So these are the units of measurement of these ions, yeah? These are the units of measurements of these ions. Sodium is, of course, is the most abundant in the body, and we have already talked about its concentration. And what did we say? It is basically found extracellular. Now, potassium is also essential for normal membrane excitability and for nervous impulses. Now, these are the functions of these ions, as we shall see. Yeah, and very important to note is that rather potassium is always found, or is found mostly, not always, but mostly, a high concentration of potassium is found within the cell, while a higher concentration of sodium is found outside the cell. In other words, it's extracellular, yeah? We also have things like chloride, calcium, very important, found extracellular, yeah? It is also usually also combined with phosphorus, yeah, to give calcium phosphate. And calcium is very, very important in bones, yeah? We have magnesium. This one plays a very good role as far as metabolism is concerned, yeah? Now, we have imbalances, sodium and chloride imbalances. Now, you should know, or we shall look at this. We shall see that you know, most ions are regulated within the kidney. We shall actually see the role of the kidneys as far as you know, ion regulation is concerned. Yeah. So sodium is regulated by the kidneys, and its absorption is influenced, as we already said, by the hormone called aldosterone, which is secreted by the adrenal gland. Now, it is responsible for water retention and maintenance of osmolarity, you know, maintenance of osmolarity. Chloride frequently appears with, you know, with sodium, yeah? And the normal concentration, as we have said, of sodium is that, and the normal concentration of chloride, as we have seen, is 95 to 108 milliequivalents per liter. Now, chloride, this one basically maintains serum osmolarity, yeah, along with sodium. So chloride also helps in what we call the acid-base balance. Now, we shall see what this means, yeah. It also combines with other, you know, with other ions, like, for example, sodium with hydrogen to form hydrochloric acid. It is, you know, potassium or even calcium where need be. And then it is usually closely tied to sodium, yeah? And a decrease in this level, remember we've talked about the normal, yeah? So a decrease might be usually as a result of GI losses, like, for example, vomiting yeah, you know, it can basically bring about a decrease in chloride ions. Yeah. Now, what are the functions of sodium? Sodium is responsible for nervous impulse conduction. Now, you'll do physiology, and you will do, you know, conduction of nervous impulses. Yeah. And sodium is basically with the help of, in addition to potassium, they are basically important as far as nervous impulse conduction is concerned. It is also responsible for osmolarity, as we have mentioned earlier. Yeah, and and within the pump, the sodium potassium pump basically pumps the sodium out of the cell, while it pumps it pumps the potassium within the cell. It also assists with the regulation of acid-base balance by either combining with chloride or the bicarbonate to basically regulate balance. Now, we shall see what we mean by acid-base balance. We shall talk about acidosis and alkalosis, but this is basically what you should know. Chloride is found in the extracellular fluid, basically responsible for osmolarity. It goes with sodium, yeah, and it is also responsible for, you know, acid-base balance, and also formation of you know, of hydrochloric acid when it comes to the stomach. Now, what are the food sources for sodium? We know that things like fast foods, or foods that are fast foods, those foods that you go, they prepare for you very fast. Those of you who like eating chips, Rolex, you know, and all those fast foods. Now, there is a very high concentration of sodium in those. Things like bacon, ham, you know, olives, you know, tomato juice. So in summary, yeah, in summary, foods that are fast foods and foods that are packed or pre-packaged, yeah, they have a high concentration of sodium. Yeah, so we're saying fast foods and then pre-packaged foods. So these foods have a high concentration of sodium, and as you can see, most of those are you know, pre-packaged or fast foods. Now, the foods low in sodium have things like fruits, vegetables, fresh meats, unsalted grains, and among others. So those are the ones that are you know, in low concentration of sodium. Now, these are the major electrolyte imbalances that you're going to come across, yeah? And it is either a hyper or a hypo, yeah? Hyper or hypo. So things like when we talk about hyponatremia, we basically mean, you know, low levels of sodium in the blood, yeah? Low levels of sodium in the blood is referred to as hyponatremia. Then the opposite of that is hyper, yeah? Then we also have hypokalemia, yeah? Low levels of potassium in the blood. And then the opposite of that is what we refer to as hyperkalemia. Then we also have hypochloremia, yeah? And hyperchloremia, yeah? Which are the, you know, the imbalances as far as chloride is concerned, yeah? Hyperchloremia, yeah? And hypochloremia. So we are saying hyper or hypochloremia, yeah? Those are the imbalances of chloride, yeah. And then the imbalances for magnesium is either hyper or hypomagnesemia. Hypo or hypermagnesemia. So those are the imbalances of sodium and chloride as well. And of course, now that you're doing this course unit of electrolytes, you should acquaint yourself with the normal ranges, yeah? You should acquaint yourself, I repeat, you should acquaint yourself with the normal ranges of these ions. They should be on your fingertips. They should be on your fingertips. I repeat, yeah? So please endeavor to cram them and make sure you get a way or a formula of getting them, yeah? Because it is going to come quite often, yeah? Someone talks about a deficit in potassium, but if you don't know the normal range, then you don't know what they actually mean. So hyponatremia, basically it's loss of sodium or too much gain of water, yeah? Which basically decreases the concentration of sodium, yeah? And what are the causes? Things like prolonged diuretic therapy, yeah? In other words, you overtake diuretics, yeah? You overtake diuretics. Things like excessive diaphoresis, you know? Things like insufficient sodium intake, things like GI losses, you know, compulsive water drinking, you know, among others, yeah? As you can see, all those can cause hyponatremia. What are the manifestations? Things like headache, confusion, muscle cramping, you know, weight gain, increasing weight, and even convulsions. These are the examples. How do we assess for hyponatremia? Basically, you monitor the patient for signs and symptoms. Things like muscle weakness, things like tachycardia, fatigue, apathy, dry skin, yeah, confusion, headache, nausea, vomiting, abdominal cramps. These might be suggestive of hyponatremia. How do we treat things like restriction of fluid? You monitor vital signs, monitor the sodium levels, you monitor, you know, IV normal saline or lactated drinkers. Yeah, of course, we are trying to give more iron. We are trying to give more sodium. Things like you can give hypertonic saline. Yeah, in case the concentration goes below, or the concentration goes below 115. Yeah. You may also give a diuretic for increasing water loss. You know, encourage, you know, a balanced diet. Things like, you know, input and outputs, IO, you know, input and output should really be monitored. You know, safety, because make sure that they are safe, yeah, because of confusion, they can easily, you know, fall, yeah. So things like you assist with ambulation, yeah, assist them move in case they have a very low blood pressure. So hypernatremia, this is, you know, when you have too much, you know, too much sodium. And again, those are the causes. Signs and symptoms can be thirst, flash skin, dry membranes, low urine output, things like tachycardia, seizures, you know, hyperactive DTRs. They are what we call deep tendon reflexes. In other words, if you enlist for someone's reflexes, yeah, then they are so reactive, yeah. That is what we call hyper-reactive reflexes. How do we treat hypernatremia? One is that you need to restrict sodium intake. You may use other substitute like potassium, yeah, to basically counteract. You remember, sodium and potassium compete, yeah, at the kidney level. So if you have more of potassium, then the better. So you can use other substitutes instead of using sodium, other substitutes that contain potassium. Yeah? So I encourage consumption of water, monitor patients, you know, intake and monitor fluid intake, you know, output and input, among others, as you can see in this presentation. Now, the potassium imbalances that we should talk about are the ones that the hypo or hyper. But you should also know that potassium is the most abundant cation, yeah, within the cells. We talked about this intracellular, and 97 is found within the cell. Yeah, we also have some in the GI. Yeah, And the normal concentration is 3.5 to about 5, yeah? 3.5 to about 5 milliequivalents per liter. And so a serum level of lower than 2.5 or above 7 can basically bring about. Now, potassium, as you can see, the lower ranges, the low, you know, the low ranges and how little it is in terms of concentration. But it can be very disastrous if it is high or even low. It can be very, very disastrous. Yeah. So it can bring about cardiac arrest. Yeah. In case it is very high or very low. Yeah. And 90% is excreted, you know, through the kidneys. Yeah. And then nervous impulse transmission, muscle contraction, enzyme action, maintenance of acid base, as we shall see. All these are the functions of potassium. What are the foods? Vegetables, fruits, meat, potatoes, things like yellow bananas. Yeah, all these are rich in potassium. Now, hypokalemia, what are the causes? Things like a prolonged diuretic therapy, inadequate intake of potassium, severe diaphoresis, GI suctioning, excess administration of insulin. All these can bring about, you know, hypokalemia. And then hepatic disease, and then acute alcoholism. What are the signs and symptoms? Anorexia, nausea and vomiting, drowsiness, lethargy, confusion, leg cramps. In other words, you feel as if your muscles are paining. Yeah. We have things like muscle weakness, hyperreflexia. Yeah, this is what we refer to as the, you know, the high DTRs. Yeah, the reflexes, yeah, tendon, you know, deep tendon reflexes. Things like hypotension, cardiac dysrhythmias. Now we shall see these. Dysrhythmia is basically an abnormal contraction of the heart. Then we also have things like polyuria. Now, how do we treat potassium? How do you treat this defect? Is that you basically give IV or per oral treatment, yeah? But it's very important, and please note this, it's very important that when you give IV, you never give a potassium as a bolus, yeah? We don't give it as a bolus. And also you always maintain, so in other words, it's always given as an infusion, yeah? With an infusion pump, and should be monitored, right? So you should also monitor the site of infiltration, yeah? Monitor patients who are at risk, monitor input and output, monitor what we call the echocardiogram. Now, these are the abnormal, in case you see any abnormal activities of the heart, yeah, you have to put the patient on a cardiac monitor, yeah, what we refer to as the EKG. Then monitor the serum, watch out for urine output, watch patients, you know, who take digitalis, yeah, for toxicity, because if you have a low potassium, yeah, then if you take digoxin, yeah, then a low potassium basically brings about toxicity of digoxin, yeah, as we shall see more. So you teach parents and families about dietary changes. Now, hyperkalemia, this one is high, yeah. In other words, it's more than 5, yeah. It is associated with EKG changes, decreased pH, metabolic acidosis. It depresses the myocardial muscle, by the way. Yeah, that is why it causes, you can get a cardiac arrest out of this, yeah? Muscle weaknesses, and then, you know, GI, which is hyperactive. You always have cramps, yeah? What is the cause? Things like increased dietary intake, excessive administration of potassium, things like damage, like, for example, burns, things like trauma, you know, all these can bring about these problems here. We also have things like renal failure or even hyponatremia, yeah? They can bring about, you know, this problem. What are the signs and symptoms? Things like confusion, lethargy, numbness or even paresthesias, yeah, of the extremities. That as you feel as if you can't feel anything, yeah. We have abdominal cramps. We have things like nausea, vomiting, flaccid muscles, diarrhea, oliguria, bradycardia, or even a cardiac arrest at worst. Yeah? So those are what is the nursing care? What must you do for such a patient? You should always monitor patients who are at risk. Yeah. Cardiac monitoring is very important. We shall see what cardiac monitoring means. Monitor for dysrhythmias, monitor BP, yeah, rate, rhythm, these are also very important. Monitor for hyperactive bowel sounds, also assess the neurological status of this patient. Medications that can be given are things like calcium gluconate. We can also give um, insulin together with dextrose, yeah, because what this does is that insulin drives the potassium inside the cell. And then you can also give you know, Kayexalate. Kayexalate, this is basically a powder that is basically taken, and then it causes, you know, potassium to be absorbed within the GI, and then you know, taken out via the anus. And then dialysis, yeah, is important, yeah. Now, when we come back, we shall, for our next session, we shall talk about calcium and its imbalances, and then we shall proceed from there. But in case you have any questions, do not hesitate to contact me. Otherwise, we shall begin from there next time. Thank you so much for being observant and attentive.